Welcome back to the PFC podcast. The views and opinions you are about to hear are the speakers and do not necessarily reflect those of anyone else. Now on to the podcast.
Welcome back to the PFC podcast. This is Dennis, and today we have two special guests who have recently, or fairly recently, came back from the Antarctic. Tim and Ian, how are you guys doing?
Good, thanks, Dan.
Outstanding. Hey, since Ian's been on here before, Tim, would you mind doing a quick introduction?
Oh, sure. So my name's Tim Talbot. I'm a board-certified emergency medicine and EMS trained physician. Spent about 28 years in the military doing various operational jobs, and then moved on to the civilian world. And I have actually the privilege of being a ship doctor for trips to the Arctic and the Antarctic, and spending about 4 months of the year in various polar regions.
Okay, so when you're I guess whatever this organization that you're dealing with, is this like a governmental organization, or is this just a civilian service that covers those type of expeditions?
So these are predominantly all civilian. They do have some research folks that come along on some of the trips to help with some of the Antarctic research, because we get into areas where they don't normally get into. But for predominantly, it's more paying customers. And this is actually, the ship's doctor, essentially the only medical person that is actually on board the ship.
Okay. So I guess because you're dealing with probably a pretty largely international crowd, how do you prepare for an expedition like this? Dealing with insurance and different scopes of practice and different norms from different nationalities.
Well, it actually gets quite it's simple from the insurance perspective. We don't actually charge, which makes it good. So they're there in kind of a Good Samaritan type role. We don't charge for the health care. We're there to provide the kind of 911 emergency services if something should happen. We, of course, like any other kind of deployment or expedition, we expect people to bring their own personal medications starting off, enough for, whatever they're going for a period of time, plus, at least an additional several weeks afterwards, just in case. Now, prepping the equipment and prepping for the journey itself, we've been doing this for a number of years. We have a pretty well-stocked kind of pharmacy, general medical equipment, to include EKG, oxygen generator, and your typical resuscitation gear, but as well as a lot of the medical aspect stuff. We actually don't have any laboratory testing other than a dextrose. So, you can get a fingerstick blood glucose, and that's about the extent of the laboratory testing you do. But I also carry as well a handheld ultrasound, which provides the only imaging available for that period. And then setting up, the good thing is, as part of the expedition staff, is most of my expedition team members, anywhere from 12 to 15 of them, will have some type of wilderness medical training. There'll be a WFR, wilderness first responder, up to and including whatever their nation's equivalent of a paramedic. Those are rare. I think my last one, I had a Japanese paramedic who was on board with me. But that's about the extent of the medical training. It's mostly wilderness first responders and what I bring to the table.
So, for things like, at least in military, things like blood transfusions, are getting to be fairly common. Does that really change when you're dealing with your clientele? Like, do you bring that capability with you?
We have not in the past, and that's actually something we're looking at currently, which to add just an additional kind of, thing, because when we look at evacuation and movements out of those areas, you're talking days for evacuation. So your definition of prolonged field care maybe a little bit more extensive than that we have some more equipment that we're not necessarily carrying. But we do provide kind of trauma resuscitation and recovery skills for our land-based stuff that we do. So we'll do some hiking, several hours of hiking up on glaciers, up in the mountains of Antarctica. They'll sometimes give, other additional sports. We'll do some either cross-country skiing, downhill skiing, snowshoeing, and sometimes even staying overnight on the continent. So you have to be prepared with a short kit that actually has all the trauma-based and evacuation-based stuff as well.
So, you had mentioned you're an ER physician, and as diverse as an ER physician can be, there's so many other specialties that probably are not covered at all with that type of education, like dentistry, as an example. What kind of training did you need to get beyond that so that you could cover kind of any type of situation and, like you said, and manage it for 3 to 4 days?
Funny enough, we see quite a bit of dental issues in the emergency department. So I'm actually I've done up to including removing teeth in the past. So not necessarily a lot of additional education. We provide a pretty much broad spectrum across all specialties. Trying to think if there's anything specific. Not necessarily, other than actually hands-on with the equipment. So, being a physician in the ER is entirely different than being the sole provider in a remote location. I may not necessarily in the ER be touching the equipment and doing the EKG and doing the lines and doing some of the other things. But once I get into that remote area, I'm the one doing all of that. So being familiar with the equipment, actually hands-on, and actually knowing the ins and outs of every equipment and every piece that you bring with you.
Yeah, Dennis, I think the thing that we picked up that really helps us with all this stuff, and the way we've learned it, is actually through the wilderness training more than anything else, because that's the one way that we're actually doing this stuff outside of the hospital setting. And yeah, I'm with Tim, and I probably see 3 or 4 dental complaints a day at a minimum every shift that I work. But it is getting used to using all that equipment outside the hospital, which both of us and a lot of the listeners obviously have done in our military time. But then with wilderness medicine, we're kind of taking it even a step further and getting used to that role outside of the fixed facility. And instead, in Tim's case, moving it into a 200-person moving fixed facility on the worst seas of the earth.
Right. Right. So you mentioned that, sometimes you have a paramedic or somebody such as that. When you do not, do you have the opportunity to cross-train an individual to help you?
So we actually have a resuscitation team that we do internally on board the ship. Everybody has a very defined role. And we exercise that at the beginning of each. So the trip's usually anywhere from like 2 to 3 weeks at a time with various groups of folks going. So we'll actually do that and actually exercise that capability. So moving someone in and around a ship, vertical, extractions up and down stairwells, it can be quite challenging at times. And to have folks on board that ship that don't know how to actually use the equipment or move the equipment or how to, basically do basic things, it has to be exercised. And we do that pretty much on a regular basis.
Okay. So I think I got a real good idea as far as the prep work going into this. Now you're, accepting the passengers and the crew. I believe when you guys went, COVID was just kicking off. So there was definitely not a lot known at the time. How were you screening guys before you went off on this merry adventure?
Well, I am very fortunate in that the group I work with, the medical director for the company itself is an emergency medicine physician, and the only doctors we hire are emergency medicine physicians. So very much in touch with this whole pandemic plan type aspect of planning. So we set it up so that we actually had screening questions that were done for all the passengers before they even set foot on the quay over by the boat. We met them at the buses where they were being dropped off. We did a temperature screening and screening of passports and travel history prior to actually allowing them to be, get back onto the boat. We were in dock essentially with about 6 different shifts at that time as we watched other folks doing their screening, which were somewhat rudimentary, never actually taking a temperature of this, occasionally taking a random temperature and not screening 100%. we were probably one of the only ships that didn't have a single COVID case, whereas about 8 or 9 other ships at the same time that boarded the same week had multiple.
Oh, that's excellent. I would imagine, is this something you had to do, when they came on board and maybe, 2-3 days later?
They never even got on the ship.
Oh, okay.
We actually screened them with a questionnaire screening several days before. Anybody that flagged on that questionnaire screening had to get up close and personal with the physician before they get on the boat. And we did all the screening and all the temperature checks away from the boat. Mm-hmm. So they were actually not even allowed to get on the boat or near the boat until they've all been screened 100%.
Very good. So once you have your healthy population, and off you go, like you mentioned, God, I forget the name of the ocean between South America and the actual Antarctic. It's very dangerous waters.
Drake's Passage. Yes.
Right. Yeah. So how did the crew and the passengers, more likely, how were they handling that trip?
So, yeah. Trying to do it gracefully. For the most part, most people try to endure that first crossing. So you're talking a minimum of about, if the weather's good, we can get across in probably 2 days. If it's bad, it's 3 days. But you're also talking the worst weather of the world, where you have the Atlantic and the Pacific coming together with both their storm systems, and they typically meet in the center. And there is not unusual to have waves that go over the ship. So you can see where we have people on multiple floors on a ship, with a ship that's rolling sideways up to a 45-degree angle, and back and forth, up and forward. Of course, the seasickness gets most of them. And it's almost universal for the first 2 days, that you're guaranteed you're going to have some variant of seasickness, no matter how seasoned a mariner you are. So that very first crossing part, most folks will have some pretty significant seasickness. Okay.
So are you just dealing with Zofran, or?
So funny enough, Zofran doesn't work very well for seasickness. So most of it is basically central brain kind of vertigo type symptom, because you got a very big disconnect between what your eyes are telling you and the three-dimensional movements your body is going through at all times. Mm-hmm. So
I guess other than, the dehydration that they probably have, is there anything that you can really do that helps better with seasickness?
Well, first of all, pre-medication is probably best. If you can pre-medicate before getting sick, you're going to do better. If you can't pre-medicate, typically there are a couple of drugs that work better than others. Phenergan, probably the go-to, because it helps you adapt actually quicker to the seasickness than anything else.
So other than the seasickness, and you mentioned, once you actually get to the Arctic, the folks are staying on ship and they're taking shorter trips with the Zodiacs to the shore. And you had mentioned, the threats of like cold water immersion. Is this somewhat common, given the the weather, the sea state there?
Well, it can be. So when the weather's beautiful, it's beautiful, and the waters are flat, and they're like just like a window on ice. When it's not so good weather, we still go out. We can have up to about 4 to 6 foot sea state. We're still going to bring them onto shore. So you always have that chance of someone taking a wrong step off the side of the Zodiac and landing in the water. Everybody, of course, has waterproof layers on. Everybody has flotation on. But still, once you get into that water, most people are a little bit shocked.
Yeah. Yeah.
Yeah, Dennis, interestingly, about half of the people on the boat, myself included, will actually do the polar plunge while we're there. So you'll actually jump into the Antarctic Ocean. And I never really quite fully appreciated Gordon Giesbrecht's 1-10-1 principle, right, and the amazing degree of hyperventilation you have for that first minute.
Okay.
When you jump in until you actually do it.
Okay.
It was.
Would you mind going over that 1-10-1 rule?
Yeah. So it's Yeah, so it's a principle that Gordon Giesbrecht out of Canada, with the guy they call Dr. Popsicle, that talks about cold water immersion, hypothermia, and so forth. And it's when you jump into or fall into cold water, you're immersed in cold water, you have 1 minute of hyperventilation that you need to get under control to keep yourself from drowning. So if you can get that under control, you won't drown. You then have about 10 minutes of functional muscular activity before you're so cold you can't do anything with your muscles. And then you have about an hour until you're hypothermic to a severe level where it's life-threatening.
Okay, and this is with protective equipment on?
This is with some sort of standard clothing for some sort of standard clothing or less. So it's not with survival suit or any of that kind of stuff. It's basically like you're in your standard day-to-day clothing when you jump in.
Okay. So how hard was it to get over that tachypnea there?
It was, I mean, I expected it and I'd seen it a bunch of times and I was able to, but there were a few words that came out of my mouth that I can't repeat on this.
Yeah. So it's funny because there's a varying stage of how people react to it, and you get to see all of that. So you get the ones that have an immediate panic once they hit the water. To be to say, we do it safely. We actually have them in a harness and a rope so we can pull them in if they panic. Mm-hmm. But you get some folks that'll get out there and swim around for, about 5 minutes. You get some folks, their foot touches the water and they're already clawing their way back onto the boat even before they've immersed themselves.
Right. So
it's varying stages of how people react to it.
Okay. So we've gotten, kind of the common ones, I imagine, like the seasickness, getting out there, cold water immersion, cold weather injuries. What other situations are you seeing, fairly frequently?
So like anything else, the typical stuff you see with folks, congestive heart failure, coronary artery disease, strokes, and your typical respiratory and gastrointestinal infections. So infectious diseases on a boat is a killer because it can sweep through the boat within 24 to 36 hours. So you all hear the horror stories about the rotavirus and, sidelining a ship of 600 passengers. So we have protocols in place to kind of deal with all that stuff, to kind of stop it in its tracks, with isolation protocols and that sort of thing. But, it's like any other place. It's the same kind of stuff that you see. So I've had anywhere from coronary disease, I've had heart attacks, I've had gallbladder surgical issues, I've had respiratory issues with, folks at 80-year-olds with pneumonias and saturations in the mid-80s, bilateral femur fractures, and some of the traumatic stuff due to the waves.
So do you generally evac them on the boat, or do you call in like a C-130 or something like that? So
that's the problem with Antarctica. There is only one real airstrip, and that's the Argentinian airstrip on King George's Island on the northern tip of the peninsula. Other than that, there is no air evacuation available. So everything is either by your own ship that you have to hold the patient for up to 72 hours to 96 hours at times. If you can get to King George's Island and the weather cooperates, you may be able to get a flight in. If not, you got another 3-day passage back across the Drake Passage to South America using your own boat and your own resources.
Right. So, you've just ruined everybody else's party to evac this guy.
Correct. So I've actually had a heart attack a day and a half across the Drake Passage. So we're right in the middle of the worst seas, and we had to turn the ship around and go back another day and a half back to port.
Right.
So that takes, people are down there for a 10-day trip, and then now 3 days are gone.
Right.
So now you have to cross back over the Drake Passage again. So, yeah, unfortunately, that's the case. If it's something that we can sustain till we get to King George's Island, and we can park them on another ship that's heading back, or we can, basically get them flown out, that's fine. If it's something that's a true life-threatening emergency, the captain makes that decision. The captain is the captain of the boat. He has the ultimate decision authority. And if he thinks that someone's, is at risk of dying, he's going to make a decision to sustain human life. So.
Okay. And obviously you have like telemedicine or any other capability as far as reach back, I would imagine.
Actually, somewhat limited. So the satellite umbrella actually only reaches about halfway down South America. So when you're talking satellite phone from Antarctica, you're talking almost flat line to the horizon. So if there's anything in the way, you're not hitting a satellite.
Okay.
So actually it can be somewhat problematic.
Right. Yeah. So yeah, you're definitely on your own, and whoever, is going to receive this patient is going to be surprised.
No, by the time we get up there, we're within a radio shot of the, it usually takes several hours to get up the river and get up into port itself and get settled into the port. So by that time they get at least several hours or maybe a half a day of notification.
Okay. Let's see.
But yeah, there's going to be no phoning a friend or any kind of consult for a lot of that. That's why that's one of the reasons I get the strap hang.
Okay. So you could blame you.
Exactly.
Yeah, exactly.
But yeah, I mean, you got to have your stuff straight in order to, have that type of responsibility for certain.
Yes, and that's the thing. That's where being familiar with equipment, practicing scenarios in your head, making sure you have the right equipment to take care of just about any other contingency. That's the biggest thing is prior preparation for everything.
Right. I don't know. Is there anything else that you guys would like to go over?
But yeah, some of the other unique aspects of it. So you get some things down there like seal bites, which you don't get anywhere else in the world. I can't say anywhere else, but for the most part, that's where most of the seal bites happen, which is very unique. You don't see that quite often.
So that's the leopard seals that are out there?
No, the leopard seals are actually pretty good. So it's some of the other seals which are a little bit more aggressive. You're down there on their breeding sites. So the males get super aggressive trying to get their harems together. If you don't stand your ground and you turn and run, they will come and bite you in the butt.
Oh, really?
Yeah. That's where most bites happen is actually in the buttocks.
Oh, really?
Yeah. So,
yeah, and those
very unique.
I'll tell you, those adolescent baby fur seals, they're like a bunch of little punks. They'll come charging at you with bared teeth. And you have to rear up, and then they'll run away. But they're like a bunch of little punks trying to take you on.
Right. Now, I would imagine you would deal with those just like you would a dog bite.
It's actually a little bit different because I get a little bit of a different flora to them. Not a whole lot of capnographis that you see with a dog bite. So typically you treat them with a combination of doxycycline and Flagyl. Definitely going to have to debride and clean. Definitely no primary closure on those wounds, right. Because they come from a very nasty mouth.
Okay. I guess other than seals, I don't know. Is there any other issues with the wildlife?
Not really, because the penguins aren't going to mess with you. They're actually more curious than anything else. Very few birds that are big enough to actually cause any issues. But usually just the seals are the biggest issue.
Okay. And I imagine if a killer whale was a problem, you wouldn't have to deal with it because the guy would be gone. So. Oh,
yes. And they're all over the place down there. But they typically are a little curious, but they typically stay away from boats.
I don't know. I guess so. How was it? I mean, is this a trip you guys would recommend?
Absolutely.
Oh, yeah, definitely. Yeah, without a doubt. And I was lucky that Tim invited me along because we actually did a longer one where we got to go out to the Falklands. Tim and I got to walk some of the Falklands battlefield while we were there, Mount Longdon, then out to South Georgia and then to Antarctica. But yeah, I would recommend it to everybody. If you ever get a chance, you gotta go down there. And that's why Tim goes back every year.
This is my fifth year doing this. So, and it's ever changing landscapes, ever changing ice flows, ever changing wildlife. The whales have rebounded over the 5 years. It's amazing how much the wildlife has rebounded with some of the conservation measures they finally put in.
Is it fairly common that they'll be looking for paramedics to go?
Yeah, unfortunately not. It's typically just a one physician, and then whoever the expedition staff, if they're trained, cross-trained in that.
Okay.
I tend to bring my medical friends, so I have a little bit of backup.
All right.
It's always good to have more than one set of hands.
Yeah, absolutely. No, very good. Well, thank you guys.
Well, thank you guys. Appreciate it.
Podcast. Be sure to go to our website, www.prolongedfieldcare.org. Find us on Facebook, YouTube, Instagram. Subscribe and stay on the bleeding edge of combat medicine. This is Dennis for the PFC Podcast. Out.
Boy, it's waiting there for you.